Hi, welcome back to Senior Savvy Cannabis. This is Katherine Goldberg. Today, I'm thrilled to be joined by Dr. Bonnie Goldstein. If that name sounds familiar, it's because on our autism special a couple weeks ago, Dr. Goldstein's research was mentioned in how cannabis has helped children on the spectrum. And I was blown away by the results of some of these studies and had to connect with you to go a little bit deeper. So thank you for taking time out of your day to chat with us.
It's real. I'm so happy to be here and share the research with you.
So there are two questions I was debating asking first. One, I usually don't do this, but I feel like you're fabulous. You'll get it. Um, I want to know what symptoms of of autism are best treated with cannabis, but I really wanted to take a step back and say, why is this controversial? I feel like I have to preface everything I say about children and cannabis and autism with, I know this is controversial, but
Sure.
why would we still why do I still feel a need to preface it like that? Do you have any?
Yeah, I have insight into that. And part of it's, again, we've all been taught that cannabis is bad. It's a drug of abuse. Only bad people use it. But we have to remember that it was a medicine for thousands of years before it was challenged and kind of removed out of the formulary, and slapped into the Controlled Substance Act, where it does not belong. It clearly has medicinal value that's been acknowledged by the government, by the medical community, certainly by the scientific literature. And it is difficult, I think, for people to separate out medical use versus either adult use, recreational use, whatever term you want to use. I like to say adult use, or for people who struggle with it, problematic use. But there's this double standard that exists with cannabis to be accepted as a medicine. There's a lot of medicines out there that just watch TV for 5 minutes and you'll get, side effect of coma and death, right? And yet cannabis doesn't do that. So I don't understand the double standard. I think one of the very important things that most people don't realize is that we as humans have something called the endocannabinoid system. We have a system within our body that's job is to maintain what we call homeostasis, balanced messages. And, frankly, we're a bag of chemicals. That's really what we are. And we have receptors and we have these chemicals that bind to them. And then the cell gets sent a message. And if the cell is sending a message of firing, overfiring, and that turns into a seizure, believe it or not, these cannabis compounds, we make inner cannabis that is actually, we're supposed to release and turn down that message of overfiring. But yet on Earth here, we have this plant that provides us with compounds that are very similar and have biologic activity that interact with the endocannabinoid system so that we can help balance it when it's not functioning properly. We can augment it to give it some balance. And most people don't realize this, but your endocannabinoid system is constantly keeping you in balance. And if you have chronic illness, chronic poor diet, chronic sleep deprivation, chronic stress, and like kind of look at the world right now, of course, we all kind of have this. This augmentation helps us just get back into balance. And all you need to do is talk to people who use it medically to hear they're all saying the same thing. I sleep better. I have a little less anxiety. I'm not as depressed. My pain is down. I'm eating better. I'm better at work. I can function. So when we think about that, why would that be just restricted to adults? What about children who have real challenges, right? And so to me, it's not controversial because what I am treating is an underlying imbalance in that endocannabinoid system, trying to help that person with medical, mental challenges to get back into balance. And at the same time, of course, treat it like any medicine. Look for side effects, drug interactions, and just, do it the right way. That's really that. And the unfortunate thing is most people have the Cheech and Chong, picture in their head. And I'm trying to undo that. So I think that's why the controversy is there, is most people don't know the science. And two, we've all been fed this media nonsense.
That's a great answer. Um, that's a great answer. And even I actively read these parenting groups for parents with children on the spectrum on Reddit. And it's the stigma is still there. The parents, whether or not they've heard success stories, they don't even know where to start. So first of all, in our autism episode a couple weeks ago, I went in thinking, okay, what I've seen with some of the children that I've been close to is that cannabis has helped them become more verbal. And that's amazing. There's a child that started with, a very low dose cannabis, mainly CBD, and was able to say, I love you to his parents for the first time.
Oh, yeah.
And that's where we're going. What I learned also that totally blew my mind is that although that's fabulous, yes, there are some children who they're injuring themselves. They're because of like their inability to regulate their stress response, their behavior, whatever it is, they end up with a lot of maybe even like head pounding into walls. They're engaged in activities that we're not even at that level of talking yet. It's a step before the talking that we have to regulate. So sure. What in your practice, are there any kind of like common denominators that the parents say like, we just don't have a clue. Like we've tried every medicine, every behavioral intervention. So I'm curious about when the parents come to you, like, do they all say the same thing right away? What's it like?
Well, so in my mind, there's, the different categories, kind of like, we used to say mild, moderate, severe, but really we're looking at like high needs, low needs, and so on. They used to say high functioning and whatnot, but in general, it's a spectrum disorder, so everybody's unique. They check the same box, but everybody has their own kind of manifestation. The patients that come to me who have the most severe symptoms are usually self-injurious, aggressive towards others. Often puberty is playing a role when hormones start to act up. They're not sleeping. Difficulty with transitions, meaning I'm on my iPad, and if you take the iPad away, there's going to be a 2-hour meltdown, which doesn't work very well when a child is in school and you're transitioning from one activity to another. Focus, speech, all of those things are kind of on the menu, so to speak. I'd like to just talk about the studies real quick. So I started treating children with autism back probably around 2014. So and I had in 2013, I've been doing cannabis medicine since 2008. I trained as a pediatric doctor, went into emergency medicine. And then after, 14 years of doing that, I was burned out, moved on, had a friend who asked about cannabis for her cancer symptoms or treatment symptoms. And I was like, I don't know. So I started educating myself, got very curious, started working in a small practice, and just kind of fell in love with it after, a few months it was so rewarding, right? It was such a rewarding career. And I was kind of done with the adrenaline, the junkie stuff by then. But so I've been doing this now 17 years. The first 5 years I focused on adults, and then children started coming into my office in 2013. So I've seen a lot of kids with epilepsy, autism, cancer, some kids with epilepsy and autism together. And there's no question, it's about a 70 to 80% response rate where people report benefits. So that's what I was seeing. So some level of benefit. Is it perfect? No, but it is helping without untoward side effects, especially if you're working with a doctor who's going to help you, figure out which cannabinoid works best, what dose, what form, and all of that. It's very hands-on in my practice. When the first study was published, and I didn't publish it, it was published out of Israel, I think it was around 2019. And they had 60 children with what they called severe, so very high needs. And I even heard from one of the investigators involved that these were kids where the parents were considering residential placement because it was just too dangerous for them in the home. And so these kids were given a 20-to-1 ratio CBD to THC. Okay, and remember, yeah,
in like a coconut, like an oil.
oil form, a tincture,
Okay.
right? And a tincture, for anybody who's listening doesn't know, it just comes in a bottle with an eyedropper and you can measure out the dosing. And the first thing to know about CBD is there's very wide dosing. There's people respond at low doses, people at medium doses, people at high doses. So the idea is to start low and titrate up to the desired effect. And what's interesting is what they saw was that about 50% or so of the kids responded well to the 20-to-1. And then the kids that didn't respond well, they added in a little extra THC to lower that ratio, right? So if you add more THC compared to CBD, it makes the ratio. And they went as low as 6-to-1. So 20-to-1 down to 6-to-1 or somewhere in the middle. And they found like something like another 30% responded. So we're talking about like an 80% response rate, which is really interesting because that's what I see in my practice in California. I have nothing to do with what's happening in Israel. And here you see these very similar numbers, right? And we see the same thing with epilepsy, very similar numbers from globally. And the oil was well tolerated. The patients did well overall. And when we look at the medications available for autism right now, there really aren't any good medications. There's in the United States, what's approved are 2 atypical antipsychotics that come with a slew of side effects: weight gain, diabetes, hypertension. And all they do is treat the irritability of autism. They don't actually help the child necessarily move forward, okay? So the first study that came out of Israel was very promising. And then there was another study that came out looking at 188 patients, so a big group, and they found something like 30% had significant improvement and 50 some odd percent had moderate improvement. And remember, when you don't have a lot of choices, you have limited medications, about a quarter of those patients were able to stop taking other medications. About a third of them were able to reduce the doses of other medications. Like 50% of them had a reduction in anxiety. Like when you look at the numbers, and by the way, safe and well tolerated in almost every study, safe and well tolerated, safe and well tolerated. So when you see that over and over, if you read the literature, where's the controversy? Read the scientific literature. They then, and out of Israel, again, they did another study where they compared whole plant cannabis, CBD, THC in a 20-to-1 ratio. Meaning they don't strip anything out of the plant. It's just the whole plant, right? With the high CBD, low THC. And they compared it to a purified CBD THC, meaning no other cannabinoids, no terpenes,
Just an
nothing
isolate.
else. Right. Nothing else that Mother Nature packages in there. And they compared that to a placebo. And it was a pretty well-designed study. And what did they show? They showed a statistically significant difference in response and they got around a 50% response rate, very similar to that first study for the 20-to-1. And remember, in the real world, if you don't respond to that, you have a million other options under the cannabis umbrella. You've got THC, you've got CBG, CBDV, CBDA. I use them all. And but what they found was a statistically significant difference between placebo and the whole plant, which they did not find with the isolate. So there's something about that whole plant, and I've been saying this for years, and Dr. Meshulam from way back in the 1960s and 70s reported the idea of this entourage, that these compounds kind of come packaged with all these other associated compounds, and they help each other work better, right? So if in the real world of cannabis medicine, a parent emails me and says, I'm not seeing good results, we change it. It's easy. It's just kind of tedious because you have to find what works for that particular child because they're all very unique. And the way we respond to most medicines is unique, right? I've had people who take gabapentin for nerve pain who say it's the best thing since anything I've ever taken. And other people say I took one dose and I thought I was going to die, right? So we all respond in our own way, even though we're all physiologically somewhat similar, right? And there's genetic input, and there's your diet and your lifestyle and your absorption and your metabolism, all of that. And that's but I will say in the world of the medical world, when a parent tells you the child is better, that's not considered evidence. That's considered, just a report or anecdote. And the research that we've done, I worked with a company called Camformatics. Their whole idea is we collected saliva from children to look at, and the saliva mirrors the body's, other compounds, just like, like drawing blood, but much easier to collect saliva at home than it is to drag a child who's fearful and anxious and hold them down and draw blood, right? You don't want to do that. So we were able to collect saliva at home and look at the saliva before and after they got their medical cannabis dosing to see what changed. And what we saw was that in almost every instance that the metabolites or the compounds in the body that reflect these pathways of aggression and inflammation and pain in the endocannabinoid system that were either too high or too low in that child. And at the same time, the parents did a behavior survey that showed that they were having severe behaviors. They take their medical cannabis, and an hour and a half to 2 hours later, we collect another saliva and do another behavior survey. And of course, the parents are reporting, yeah, no, the child is doing better. This is what we expect when we give them this medicine. What we saw was that the metabolites that were out of whack, let's say, like almost like if you get a cholesterol blood test, you may have a low, you may have right in the range, or you may have really high. So anybody that was high or low, they shifted towards what we call the physiologic mean, which we established those numbers by looking at children who are neurotypical, who did not have autism. So we had established this kind of physiologic range, kind of like what's the range where it should be. And so we demonstrated for the first time that cannabis treatment is homeostatic. It brought up low levels and it brought down high levels and helped those and correlated to the behaviors that the parents saw. So this gives us an objective.
Incredible.
Yeah, it's crazy. It gives us an objective way to measure the impact of medical cannabis. So now I could argue that I don't need that test because I can just tell by what the child's doing better, like who cares what the metabolites are. But the problem is that I can't tell when a child comes in which cannabinoid, which metabolite is off in that child. It's kind of like saying, well, let me treat you for anemia, but I don't really know that you have anemia because I haven't done a blood test, right? So we could get a baseline saliva sample, see where the child is, compare it to other patients who have already been mapped to see which cannabinoid works for which metabolite. That's the data we're all collecting. And then you have a starting place at least. And then I can measure the saliva again 3 months later and see what corrected, what didn't correct, what is the parent saying that they're still trying to work on, and can we narrow in? And the whole idea here is to kind of cut the time shorter from the trial and error to a more personalized focus based on the child's individual chemistry. So that's the idea behind the research. Now, it doesn't stop us now from treating patients, but this would be like, we're hoping to have this available as a kit to be able to send to families to be able to do this test at home. Very convenient, as long as the child can provide can spit into a tube, we can collect the data. So that's what the research is. And it's just really exciting because I believe the parents when they tell me that their child is better, because when they're not better, I hear it, and that's fine because, I'm trying to help. But it would be really nice to know which cannabinoid treats which metabolic pathway in which person, right? To have that detail of their chemistry.
That's incredible. I mean, that this is remarkable on so many levels. The efficacy in the first place, the fact that you can tailor this medicine to the individual.
Yeah.
And
And
just
I want to say too that there was a study that came out in 22, I think it was, that showed that CBD does treat core symptoms of autism, whereas really we have nothing else that treats the core symptoms.
so what about the families who are not in California like us, who have maybe heard whispers of of this miracle plant that is helping children? Where do you think they should, for the families that can't uproot their lives, and
Right.
which I know that people make these medical pilgrimages to have
Yeah.
access to cannabis, which is absurd. But where should like the regular family start? Not
So
that
the
there's
first,
an
yeah.
answer, but yeah, what do you think about that?
Well, so it's not an easy answer because there's not a lot of physicians that have adopted cannabis medicine, but there are some who have. We also have nurse practitioners who have filled in the gap
Hmm.
and have a lot of experience, as well as other healthcare professionals who are interested in this. I mean, children, I would say that you would want to work with somebody who has experience and who's been doing this. So, one thing that I developed last year is that I started a new company called Goldstein Wellness, and it's a website, goldsteinwellness.com. And so, after 17 years of doing this, I'm like so frustrated that how is it that there aren't more doctors doing this? Because what I see day to day, not just in autism and epilepsy, but chronic pain, cancer patients, people with other challenges, diabetes, brain injury, concussion, Parkinson's. I mean, the list goes on and on. The endocannabinoid system is involved in so many autoimmune disorders, right? And of course, there's times when it's not appropriate. There's times when you should. When I've tell people, no, this you're not a candidate, right? But if a child is struggling with epilepsy or autism, they're automatically a candidate in my mind, unless there's really some compelling reason not to. But I started this company, Goldstein Wellness, and it's basically a website for licensed healthcare practitioners to sign on. They get a free account and they get access to all my education. I just took everything
Cool.
I've learned in the last 17 years, all the data. I made a certificate course. There's about 30 videos, condition videos, webinars. There's a forum to ask questions where I go in and answer questions if you have a question about it. The videos are in modules. So there's endocannabinoid system, the cannabinoids, the terpenes, safety, side effects, drug interactions, how to pick products. I mean, it's soup to nuts, okay? And on that website too, not only is it for practitioners, but it's also for patients to connect with practitioners. So if you go to Goldstein Wellness and click on Get Started, there's a button that says I'm not a practitioner. If you click there, you can actually search by state. We have over 200 clinicians that have signed up already, just since we're in business a little bit less than a year, and we already have so many doctors. There's curiosity,
They want
but
it.
they want it. They want, because how are you practicing medicine in 2025 without any knowledge about cannabis? It's been around for a long time now, and patients are coming in and asking about it. So when people come in and ask, you should be able, and that's my goal was to be able for clinicians, even if you didn't really know how to recommend it, to be able to at least have a conversation. What do the studies show? Are you a candidate? Is it safe for you? There's going to be those who are just adamant against it, and I'm never going to crack that nut. But at the same time, there's enough clinicians out there who hear from their patients. Oh yeah, I don't need my sleeping pills anymore. I don't need my Xanax anymore. Oh yeah, no, my opioid is lasting, my prescription for 1 month is now lasting me 4 months. Ask them why. What are you doing? And and we do know from surveys that a lot of people are afraid to mention medical cannabis.
Mhm.
And I will share that when in my practice, when people say, "Oh, my doctor said that I should look into medical cannabis," these patients are so appreciative that you brought it up, because it kind of gives them a little more confidence to say, "Okay, this is a real thing and maybe it will help me." Should we let people suffer? Should we let people become addicts? Should we let people, I mean, how many people have to die from opioids or combination opioid benzos. I mean, we have an epidemic here of death, and it hasn't really gotten that much better, has it? Yet we have, and again, separating medical from non-medical use. We do it all the time with other substances, right? And so I don't understand why the medical community especially just can't seem to separate the two, because I'll tell you, in the medical, I'm the biggest chicken that there is, I admit to it. And I recommend it and help people with it all the time. And I'm the first one to tell them, you know what, we've been through all the cannabinoids. You're not I'm sorry to say, you're in that 20% that don't seem to respond. Take your money and your resources and try something else, because this isn't working. But when it works, boy, it can be a really important part of somebody's day-to-day regimen.
Absolutely. Well, I feel like we haven't even touched the surface of what's possible here. We're running out of a bit of time. So I'm definitely going to have you on again. But this is fantastic, because I think you kind of really drill down to the heart of the matter, is that it's great if I'm talking about cannabis and autism, but I'm just someone with a podcast. That doesn't really matter. It has to be coming from the doctors. Without coming from the doctors, the parent, that's how it has to happen. And we know that the doctors are curious. So I'm so thrilled that you made a single place for them to go to get all the information, because that really is the start, and connecting the doctors with the patient, and just having everyone know that they do have options here. This is fantastic.
Can I share one thing with you? So a few months ago, I got an email from a pediatric neurologist in Texas who reached out and said, hey, you know, I read your book and I started treating patients. So he started treating patients with autism in 2019. And I guess maybe that was around the time that Texas had approved some CBD products legally. And he's now treated over 200 children with autism.
Oh my God.
He's seeing like 85% response rate, which is really good. And just with a handful of products, and he's writing a paper about it to publish. But I want to just say that, like, you know, people might look at me as just like this cannabis doctor and, you know, I'm fringe and all that. But when you have pediatric neurologists, right, pediatric cancer specialists adopting this and talking to parents that this is an option, I do feel like it puts the mainstream stamp of, you know, approval on it. Not that we need that, but I want, you know, the one of the things that I find frustrating is that people keep saying there isn't enough research.
Right.
Now, right? We definitely could use more research, but we have enough research to show that under medical supervision, it is safe and well tolerated. I'm doing a research. We got myself, 4 other physicians got a grant here in California. And our research is looking at patients under medical supervision. We've had 600 patients answer, actually a little bit more than 600 patients. We're right in the middle of, you know, crunching the data. But what we found so far is only 2 patients went to the emergency room for questionable cannabis related. One is definitely cannabis related because the product changed and the dosing changed of the product, and the person had taken a higher dose than what she thought. The other one was a child with a seizure, and we don't know if they had I don't think it was cannabis related because they already had a seizure disorder, but they ended up in the ER during, you know, and it was a question. I don't think it's related. But, you know, when you think about that many patients and how many ER visits, when we compare that to the problematic use of cannabis or people who don't know what they're doing, who end up in an ER with an overdose because they're too high and they're freaking out mentally, right? Because it can be very uncomfortable. Or cannabinoid hyperemesis syndrome, which is a real thing. Those are much more frequent. Those are not medical use, period. Not medical use. So again, I want to make it very clear that there's a big difference between medical use and the non-medical use. And just because somebody says I'm using it medically without supervision, they may have figured it out. And I know a lot of people who figured it out, works great. They don't need medical supervision. They're responsible people doing a bang up job with their own regimen. But if you don't know what you're doing, how
Or
are
it's
you supposed
a
to know?
child. Yeah, you
Right,
want,
right, or a child. How do you make it? How is it medicine if you don't know what you're doing? If I diagnose you with pneumonia, I wouldn't say, okay, go pick a medicine. I would tell you what to take based on the studies and the research and my clinical experience. So I just want people to understand that it is a real thing. I see it every day. And I wouldn't be doing it if I didn't think that it was helping people, especially children.
well, thank you so much, Dr. Goldstein. I really appreciate it. And I know you're just making such a fundamental difference in these people's lives. The I Whenever people say there's not enough research, I say, haven't you heard the stories from the parents? I know it's not research, but
But
I,
there is research that supports that. It's that people don't know that the research is there.
so we'll link to what we can link to. Any of your papers
Sure.
that's been published, we'll link to your book. And if it's okay, I will send people directly to you if they are questioning if cannabis is right for their child, and maybe you can help direct them to
Yeah, they can go to Goldstein Wellness and look for a clinician in their state because
you can,
for a child, you want to have legal protection
of course.
that you're doing it under the laws in your state. Unfortunately, there's been a lot of hatred towards CBD this last year or so, which is really ridiculous. But this is medicine, and people should seek out help.
And parents
Uh,
can do it legally. You can do it above book. You can do it the right
yes,
way.
right. And
Um,
not every state allows you, but most states do.
Good.
Yeah.
Okay, that's fantastic. Well, I feel like we're really at a tipping point with autism, and like we're right there. It's been long enough of having no relief.
That's
Um,
right.
so thank you for this, and we will definitely have you back because there is so much more to talk about, not only with children, but maybe with the elderly and with everyone,
Mhm.
because we fundamentally know that this plant helps. And it does so because it's a balancing act, right? Our systems need to be
Right.
balanced. So thank you for taking time to explain this to us. And it was just really, really enlightening. So thank you so much.
That's my pleasure. I'm happy to come back.
Awesome. Okay. Thank you so much.
Bye.
Bye. 1 second.